Hello, my name is Johnny Binder, Deputy Director for Cameron Park Zoo. Welcome to this edition of Step Into the Wild. As animal husbandry and veterinary care advances in zoos, a bigger emphasis is put on geriatric care with animals. It is especially important in Cameron Park Zoo because many of these animals have been here since 1993 or shortly thereafter. And so many of these animals are approaching the ends of their lifespan. All of these animals have a very special story to tell. And today our staff would like to tell you about each of these animals, the special diets, the special enrichment, the special care and welfare that each of these aging animals are receiving. I think one of the things that's most significant to me is the loving and special care that each of these animals gets from a trained animal care staff. That's very, very important when managing these animals. Join me as we step into the wild.
My name is Katrina Lee. I am one of the carnivore keepers here at Cameron Park Zoo, and I'm here to talk about Shampha, our 21-year-old female African lion. She is one of our geriatric animals here at the zoo and our only geriatric lion. And we do some special things with her. One of the main things we do with her is we feed her a little bit differently than all of our other lions. She actually feeds off a bucket, so we put a bucket down, put her meat on top, and she eats off that. So she doesn't have to bend down and get her food to help with any kind of arthritis she might be feeling. We also train her a little bit different than the other lions. There are some behaviors she knows that we don't do with her. We don't ask her to stand up on her back legs or roll over anymore, just to help her stay healthy and not make herself sore or anything like that. And we also give her a varied diet. Unlike our other lions, they get a senior diet or a special feline diet. She gets a senior diet, which has a little bit more different nutrients in it for her because she's older, as well as a variety of beef heart, fish, and beef loin. And she gets that every day because she's picky. And it's one of the things about her. She's definitely picky about what she likes. And so we changed her diet up a little bit to help her want to eat it all. One of the reasons that the varied food helps us so much is because she is on some medication, joint supplements and stuff to help her stay healthy. And we use her food to do that. So because she is so picky, we can't just put her medication in one type of food because she won't always take that. So we have to use some of her favorites, which is right now the beef loin and the beef heart. We could put her medication in there and she takes it voluntarily. When sometimes we offer her Nebraska diet and she says no to us. The reason that we do specialized training with her as well as different types of feeding is quite a few years ago she actually hurt her back, her spine. She had to go to Texas A&M and have surgery for that. So we want to make sure that she's not doing anything that would cause pressure on her back legs specifically. So we make sure with the different types of training, how we feed her, that she is not going to put any pressure on her back. We do a bunch of different stuff. One of the main things we work with her with a lot is injection training. Just in case she ever needs to have an injection of steroids or something like that, we are able to train her and have her do that voluntarily. I'm currently going to start working on an eye treatment with her. She's getting some treatment done with her eye. And so we're going to work on getting her to voluntarily present her eye so we can put drops in it.
Hi, my name is Christopher. I am a mammal keeper here at the Cameron Park Zoo. With us today is our resident male North American black bear, Baloo. Baloo will be turning 21 here soon at the Cameron Park Zoo. At 21, that is getting up there in terms of black bears. On average, North American black bears in captivity live to be around 25 to 30 years old. So Baloo, he is showing a few signs of arthritis and joint discomfort. And here at the zoo, we manage that in a number of different ways. So one way that we manage Baloo's arthritis is we try to just get him to stretch a little bit every single morning. We do feed him lunch and we try and wake him up and get him to move around the exhibit every day at lunchtime just to keep his joints loose. And then we also do some training with him in the morning to just get him to lift his paws, get the ankles rolling, and get him to stand up. So another way that we try to manage Baloo's arthritis is we try to give him some softer substrates that are a little bit easier on his joints. One of those is a few years ago we made this bed for Baloo. It's made out of a hospital bed and we wrapped it with fire hose just so he can't really destroy it. And it just gives him a softer surface that he can lay down and sleep on at night, just to alleviate some of the pressure. All right, so a third way that we manage Baloo's arthritis here at the zoo is through medical management. Every single day he does get some joint supplements. And then we also have Baloo trained to come into our squeeze, which is attached to their night house. And that's just so if we need to give him any sort of injections or anything like that, it is voluntary and we don't have to knock him down. Every morning when we're setting up the exhibit, we scatter fresh fruit all around the exhibit. That way Baloo and Donna both have to more or less scavenge for it like they would in the wild. That also keeps their joints loose and active because they're having to climb up the hill in different terrains and just move around a lot. We also do the same thing at lunchtime every day. When we come out here and we throw them their lunch, it just gets them up and moving.
My name is Nick Golightly. I'm a hoofstock mammal keeper here at the Cameron Park Zoo. And Jenny here is definitely my favorite animal in this zoo. I love her to death just because she's got so much personality. She can be definitely one of the sweetest animals, and she can also be one of the sassiest and one of the most stubborn as well at times. If she decides not to come out for that day, we'll just let her make that choice. Usually if there's a little bit of rain in the air, if there's puddles on the ground, she is a diva that way and she doesn't want to get her little feet wet. So we'll let her kind of make that choice and stay inside for the day. And then also we're working on doing voluntary hoof trims with her to help her move a little bit better, to help her not get as much stress in her joints. She's not putting a lot of weight around her joints, and she's not causing a lot of pain or arthritis. So we're working on doing that. We're working on touching her hooves. She's a little reluctant to let us touch her hooves at the moment, but we are working on repetition. We have a couple ways that we're able to work with her. We have a chute that she's able to be in, and we can open up one of the ports and touch her hooves that way. We're also working on having her come up to fire hose barriers where we can put a block underneath and she can curl her hoof on top of that for us, so we can check underneath and scrape out any rocks or and keep it clean as well, and do any trimming that we need to do.
So this is Babe, our older female white rhinoceros. And today we're going to be doing a bandage change on her. As she's gotten older, she has some arthritic issues and some degenerative joint disease. We have an area on her back left leg where I think initially it started as a superficial wound, but developed into a pressure sore. So we've been doing bandage changes daily and using topical medications to help it heal. Right now, as we start the bandage change, I just need to pull off yesterday's bandage. Rhino skin in general, it's really hard to find any kind of tape or adhesive that stays on very long. It just has to do with the way that their skin is. And you can see right there the area that we're treating, and it's actually healed quite a bit since we initially started. Try and make sure it's actually pretty clean because the bandage stayed on for the most part. I'm going to apply a topical medication. So this is actually a fairly new product. It's actually what they call a biosynthetic glass. And it's thought that it aids in wound healing, speeds up the recovery process. So I'll just apply that directly. So as animals get older, similar to human beings, especially when there's signs of arthritis, you can end up with some skin wounds. And because of their age and other factors, you can have difficulty healing, especially depending on location.
In managing geriatric animals, obviously we take a lot of steps to try to give them the best quality of life and give them as much longevity as possible. And then once we see their welfare begin to decline, we sometimes have to make really tough decisions to either humanely euthanize, or sometimes their health will just decline to the point that they do pass away suddenly. And that's very challenging for us as keepers. Obviously, we have a very strong bond with these animals. For myself, I've worked here for a very long time, so I've seen a lot of these animals actually come in as youngsters and then grow up, have children, and even grandchildren. So in our work, in our line of work, we are very, very connected. So in losing the animals, we also, it's a huge sense of mourning and loss. I find it really important to really talk to staff. We have a lot of conversations leading up to health issues. We'll do welfare assessments on the animals just to make sure that we're staying on top of where their quality of life is. And then in the grieving process, we make sure that we have conversations about just what the loss is. The city is really nice, and a benefit to our employees is the fact that they do offer counseling if necessary, and some staff may choose to use that route, but the benefit is well worth it. We get to spend so much wonderful time with these animals and have so many positive encounters. You know, we often, at least for myself, I look back on the memories of those animals very fondly.
The Cameron Park Zoo in Waco is a member by invitation of the World Association of Zoos and Aquariums and is an accredited member of the Association of Zoos and Aquariums, a worldwide organization of more than 200 accredited members who are leaders in global wildlife conservation and assistance in helping animals in their native habitat. For more information, visit CameronParkZoo.com.